Hello, I'm Katrina Hughesman. I'm a family nurse practitioner student. I'll be doing your assessment today. Can you tell me your name and how old you are?
I'm John. I'm 53 years old.
Okay, what brings you in today?
Coming in, I was raking my leaves last night and I had chest pains.
Okay, are you having any chest pain now?
No, it was just last night.
Okay. Just had to wash my hands there. So last night raking leaves. At what point in raking the leaves did the chest pain start? Were you just starting or were you almost done?
Oh, no, I was almost done.
Okay, and where was the chest pain located?
Just right here in the middle.
Okay. How long did it last, did you say?
Probably about 10 minutes.
Okay, and what did it feel like?
Just tight, like cozy and
Okay. And was there anything that you did when you noticed the chest pain that made it worse?
No, I don't think it got worse.
Was there any activity that you did that made the chest pain feel worse or better? Like, did you keep raking when you first noticed it, or did you stop and rest?
Well, I started to, but then as it got, I felt it more. It started faint and then it got stronger, then I rested.
Okay, and did it get better when you rested?
Yeah.
Did you try anything else for the chest pain?
Well, when it first started, I took a Tums.
Okay.
I thought it might be a reflux, but
had you eaten recently before the chest pain?
No, I was gonna have dinner after I got done with the leaves.
Okay. Did the pain radiate anywhere?
Nah, I don't think so.
Was your arm sore at all, your left arm?
It might have been, but I was raking, so I couldn't tell if that was it or if I was raking.
Okay. Anywhere else, like your neck or your shoulders?
No.
To your back or your jaw?
No.
Okay. And we already established it was towards the end of raking. On a scale of 1 to 10, with 10 being the worst pain you can imagine, how severe would you rate the chest pain?
Oh, I'd call it a 7.
7, okay. Anyone else you know of been sick recently or had any kind of similar chest pain symptoms?
Not really, no.
Anyone you know is sick?
Oh, my brother's got a cough. Yeah, no chest pains. He's just coughing.
Okay. What other symptoms did you have with the chest pain? Were you sweaty?
Yes, I was sweaty.
Any nausea?
Oh, yeah. Yeah.
Okay, did you feel weak or tired?
Yeah, both.
And then were you short of breath?
Oh, yeah.
Did the shortness of breath go away when you rested along with the chest pain, or were you still short of breath?
No, the more I rested, the better it got.
Okay. Did you pass out or feel like you were going to pass out soon?
Nope.
Any dizziness?
Dizziness? No.
Any palpitations?
No.
Are you coughing at all?
No.
A regular heartbeat?
No.
Have you ever had something like this happen before?
No.
Okay.
No, first time.
Tell me about your medical history. What conditions do you have, or have you been diagnosed with?
Well, they told me I've got high blood pressure and high cholesterol.
Okay. You said reflux also?
Oh yes, reflux. Yeah, that's why I took the Tums. I thought,
Okay.
that's what we were having, but
Any diabetes?
no.
Any known heart disease?
No.
Respiratory conditions?
No respiratory.
Do you have sleep apnea?
Yes.
Okay. Have you ever had any surgeries?
No.
Any family history of heart disease?
No.
Has anyone in your family ever died suddenly?
No.
Okay. As far as your wellness history goes, when was the last time you saw your regular doctor?
Oh, about a year ago.
Okay. Are you keeping up with your routine screenings and evaluations?
My screenings.
Are you seeing your doctor once a year, or how often do you normally see him?
Yeah, about once a year or so.
Okay. Have you ever done a stress test before, a cardiac stress test?
No.
Okay. Did you get your flu shot this year?
No.
Okay. What medications do you take?
Well, I was taking stuff for the blood pressure and the cholesterol. I ran out and, just kind of stopped.
How long ago did you stop taking your medicines?
It was about 6 months ago.
All right. Are you taking anything besides Tums at home? Like, do you take an aspirin every day?
Nope.
Anything else besides the Tums?
Nope.
Okay. Are you allergic to anything?
Nope.
Do you smoke?
Yes.
How much do you smoke a day?
About 2 packs.
And how long have you been smoking?
About 30 years.
Okay, so 30 years, 2 packs a day, that's a 60-pack year history. Do you drink alcohol?
Yeah. Yeah.
How much do you drink?
I have a couple beers a day.
Okay, how many is a couple?
2 or 3.
And is it just beer, or do you also have anything else, like wine or liquor?
Nope, just beer.
Okay. And what do you do for work?
I'm a construction manager.
Alright, is that a very laborious role?
Oh, no. Nope,
Okay.
I'm not laborious.
Okay. Are you married?
Nope.
Have you ever been married before?
Yes, I was.
Okay.
Twice.
How long ago did you get divorced most recently?
The most recent one was 10 years ago.
Alright. Are you seeing anybody now?
Mm-mm.
Okay. Just trying to identify your support system for you here. Tell me about your eating habits. Do you consider yourself a healthy eater?
Oh, probably not. No.
What do you usually eat?
Just grab something out in the truck, driving job site to job site, eat when you can.
Okay. Do you exercise regularly?
Nope.
Or I know you're going all over town here for different jobs. Do you ever have to travel for work, or have you traveled recently?
Nope, I don't leave town at all.
Alright. Any pets?
Nope.
Okay, we're just going to go over some symptoms here. So in general, you mentioned that you were sweating, you were weak, you were tired. Have you noticed any weight loss or weight gain recently?
Nope.
Any fevers?
No.
Okay, and we talked about your chest pain. You said you haven't passed out, don't have any palpitations or dizziness. Have you noticed any swelling anywhere?
No.
Any pain in your legs?
No.
Do you ever get short of breath when you lie flat, like to go to sleep at night?
No.
Do you ever wake up short of breath?
No.
Okay. You said you were short of breath on exertion and you're not coughing. Do you snore?
A little bit.
Okay. Do you ever cough anything up? Any
No.
sputum, alright?
No. No.
You said you were nauseated during the episode. Did you throw up?
No.
I just thought it might have been heartburn. Any difficulty swallowing?
No.
Any pain when you swallow?
No.
Have you noticed any changes in your bowel habits? Any abdominal pain? Okay. Alright, well let's go ahead and move on to the physical assessment. I see your vital signs here. Your blood pressure is high, 160/94. Your heart rate is 84. Respiratory rate is 18. Pulse ox 98%, and your temperature is normal, 98.4 degrees Fahrenheit. If you don't mind, we'll have you start the exam by lying back. If you could kind of sit up slightly here on the pillows. Okay, I think that'll be fine. Just going to grab the stethoscope here. Alright, I'm going to start by feeling your carotid arteries on your neck. We'll just do one side at a time. The carotid pulse here is 2+, it's strong. There's no thrills or anything noted, no variations, brisk upstroke. Go to the other side here. You can just keep looking straight ahead. And that pulse is also 2+, strong. There was no variations noted. There was a brisk upstroke. We'll now assess the timing of the carotid pulse. Just going to listen to your heart while I feel your pulses again here. Other side. Okay. So the carotid upstroke is after S1, but before S2. It's in the middle of both of those on both sides. We'll now take a listen to the carotids. Alright, going to have you take a big breath in and hold it. Okay, breathe out. You can get a couple of breaths in there. We're going to do the same thing again. As soon as you're ready here, big breath in and hold it. Okay, thank you. There were no bruits auscultated on the carotids either. So now we'll move on here to the cardiac assessment. We'll start by inspecting the chest. I don't see any obvious lumps or masses. There's no visual palpations here in the precordium. I can see his carotids pulsating though in his neck. We'll now palpate. Let me know if you feel any tenderness at any point. We'll start the aortic point.
Nope.
Pulmonic.
No.
Herbs.
No.
Tricuspid.
No.
Mitral.
No.
Okay. There were no thrills or any heaves or lifts noted. Can you sit up just a little bit more, please? Scoot back a little bit. All right. Thank you. Going to try to find his point of maximum impulse here. Okay, the point of maximum impulse is on the 5th intercostal space, kind of about 2 centimeters lateral to the midclavicular line. It's about 1/4 size in diameter, maybe 2.5 centimeters in diameter, and it's a brisk tapping sensation. We could also assess the duration of it by listening with the stethoscope and then calculating how long it goes through S1, so I can go ahead and do that here. Probably about 2/3 of S1 for the point of maximum impulse for duration. We'll now go ahead and take a listen to the points of the heart. I'll summarize my findings here at the end, starting with the diaphragm. Just breathe normally, starting at aortic, pulmonic, herbs, tricuspid, mitral, S1 and S2 were noted throughout. There were no murmurs or gallops. Aortic, pulmonic, herbs, tricuspid, mitral. S1 and S2 were noted throughout. There were no murmurs or gallops. I'd like to also go ahead and take a listen to your lungs if you don't mind. Or actually, we'll have you turn to your left side here. We'll listen to your heart on you lying on your left side. Thank you. Okay, thank you. You can now sit up. There was just still a clear S1 and S2 noted in the left lateral position. Listening with the bell over the mitral valve, there were no murmurs or gallops. So we'll now have you lean forward slightly. And you don't want to rest on your elbows, just lean forward. Going to listen to everything again with the diaphragm. Aortic, pulmonic, herbs, tricuspid, mitral. It continues to be a clear S1 and S2 noted throughout without any murmurs or gallops. We'll now just take a listen to the lungs. Have you take a nice breath in and out through your mouth each time I place my stethoscope. Sorry. clear lung sounds in all lung fields bilaterally on the anterior chest. We're going to listen to the back. If you could swing your knees around here. I'm just going to angle you a little bit. Okay, continue your breaths in and out. Okay, there are clear lung sounds noted bilaterally on the posterior chest as well. We'll go ahead and summarize our findings here. I'll sit right here. Okay, so for differential diagnosis, my primary is stable angina pectoris, and this is confirmed by him not having chest pain currently at rest. It was on exertion and it was relieved by rest. He has several positive risk factors, also concerning that he quit taking his medications and he's not even on an aspirin. He had positive associated symptoms, including the classic mid-sternal chest pain, and he did that fist motion that's really typical for that. He was diaphoretic, nauseated, fatigued, weak, short of breath on exertion. There was no family history or anything to coordinate with that. But he's the smoker, high blood pressure, high cholesterol, sleep apnea, and then he also mentioned the reflux. And he's never had a cardiac workup before, so this could be a new problem. Would have ruled out an acute myocardial infarction by doing a EKG right at the outset. I would assume that the medical assistants in the office would do an EKG on anyone who's coming in with chest pain, but we'd still do that early on in the assessment and rule that out, or kind of facilitate a more rapid evaluation of that. We ruled out respiratory concerns for anything, with him not coughing, no fever, no other issues, and then his lung sounds were completely clear. So my third possible differential diagnosis could be reflux pain, but it wasn't brought on by a large meal. His symptoms were not relieved by an antacid, and he didn't report any cough, and the sensation was more of like a tightness rather than like a burning or anything, more along those lines. So this concludes our cardiac assessment. Thank you.